Everyone, and welcome to another educational webinar hosted by Life and Breath Foundation. My name is Saul Kachauskas. I'm one of the board members here at Life and Breath. We're happy to have you with us tonight. We have a topic, stand up for your health, how to advocate for yourself and ensure coordinated care. So before introducing our speaker, I'd like to take a moment just to share a little bit about Life and Breath Foundation. We aim to provide the sarcoidosis community with practical tools to track their journey, understand medical issues, and enhance their quality of life. We strive to create a supportive environment where those affected by sarcoidosis can share their experiences and find encouragement. We also work to raise awareness within the medical community to better address and combat this chronic disease. What we do, we are a volunteer-led organization. The money we receive does through donations and sponsorships goes directly to helping patients with sarcoidosis. Some of the services we provide, we have this monthly speaker series. We also have Life and Breath Scholar, physician education, patient support from sarcoid experts, patient support through sponsorships and education, and we also have my Life and Breath planner. Our speaker tonight is Dr. Irina Koyfman. She's been with us before. She's an accomplished clinician with more than 20 years of executive experience. Her professional focal points include an understanding of strategy, healthcare insurance, business development and operations, care coordination, and evidence-based quality care. Irina, floor is yours.
Hi, everybody. Welcome. Thanks for coming. Um, I'm here to hopefully guide you and lead you in learning how to become your own patient advocate, maybe your loved one's patient advocate, and how important it is for you to know how to coordinate your care and how to take charge of your healthcare. Because unfortunately, it is not being done right now, and our healthcare system is failing us because it's really very much broken down and it's very fragmented. And what a lot of patients, don't understand is that when they see a provider on their computer taking notes, they're in your electronic medical records. A lot of people think that everything is documented in one place. The reality is it is not true because, for example, so we are local, we're here in Maryland. And for those of you that are in Maryland, you'll hear the names and you'll know, but it happens everywhere. But for example, our big hospital group, LifeBridge, they are on EMR that's called Cerner. Hopkins is on Epic. um, somebody else could be on eClinical Works. And these are definite, they're literally like, think about them as, yes, they're cars, yes, they're electronic medical records, but one is Lexus, one is Mercedes, one is something else. It's not that one is better than the other, but if you have a Lexus, you're not going to take it to Honda for it to be fixed. And so electronic medical records do not connect to each other and they do not speak to each other. So if I'm seeing Dr. Abigail, who is my sarcoidosis doctor at Hopkins, hi, Dr. Abigail, and I see Dr. Saul, who is my sarc ophthalmologist in Mercy, and they don't have the same EMR, they don't know what each of them have talked about. And I'm going to ask you, Saul, our wonderful board member, if you know, because you're in healthcare, but do you know how much time on average, based on the studies that were done in actually 2016, I think it's way worse now, how much time on average doctors or providers spent with the patient during the visit?
Actually, communicating with the patient, the studies I've read about 7 or 8 minutes. Is that correct?
It's so they're saying about 13, but I do believe it's more like 7 right now because this was done in 2016. Um, But what they found is the average time is about 13 minutes with a patient. But then the average time of documenting is 15 to 16 minutes. So 100% of the time that provider spends with you, they spend then in documenting your care. So one negative is obviously they're not spending a lot of time because imagine if, I was just a patient at the brand new OBGYN office and, it's a head to toe assessment. Like they really need to get you undressed in a gown, check everything, look everywhere, listen to every organ, talk to you, understand you. Can this be done in 15 minutes? I don't think so. But then when you think about it, but the good thing is they're taking all this time documenting. Okay, but now let me ask you this. If I took 15 minutes in documenting, that means that your record, that visit, it's probably going to be three, four, five, maybe 6 pages. So now if I saw Dr. Abigail as my doctor yesterday, and now I'm seeing Dr. Saul needs to look at what Dr. Abigail wrote, which is 5, 6 pages. That is all part of that 15 minutes. So now imagine when your medical record is, you're seeing different specialists, maybe you were ill for a while. It becomes so complicated, so convoluted, and everybody's using templates, which means there's some information kind of buried in between the lines that every provider has to read. Nobody has the time. Unfortunately, it's just medical record made so many things so amazing and more simplified and easier, but it also made so many things more complicated, and there's so much waste in the time spent. But then you can't expect your new doctor to take 2 to 3 hours to go through your chart to truly understand you. So this is where, my friends, we need to all learn how to advocate for ourselves and how to make sure that things do not fall through the cracks. And we have taken our time and really designed something, in my mind, amazing. And we call it, your sarcoidosis tracker. This is a free resource that you can use, electronically, or you can use it as a, PDF or Word document. But this is your medical record that belongs to you. And it's not super complex and it's not 20 pages. And this is something that you can update and have relevant information. So when you see your new providers or follow-up providers, you can bring that, and then you have to force your providers to look at it. I would spend 5 minutes of my 15 minutes time with the doctor to actually review my information, because this is what's important to me. I don't want them to read 300 pages that I don't even know what they're reading, right? Maybe they're reading something that happened to me 6 months ago in the hospital because they haven't seen me before that. I want them to concentrate on what is important right now. So the tracker has your medications, your symptoms, all of your specialists, anything that happened to you recently, your labs, and really all the relevant information. And I remember like it was yesterday when we first, I got involved with Life and Breath years ago because I'm very passionate about teaching people how to coordinate their care. Because as I said, I was also under the impression that, oh my gosh, when I'm seeing all these doctors, everybody's communicating, everybody knows. And then, then when it didn't happen and I'm in a healthcare system, I recognize that there's a huge gap that needs to be addressed. So I remember that we met one very, very lovely, very intelligent, very highly educated patient that actually had, unfortunately, severe sarcoidosis where a lot of her organs were affected and she had to see in a lot of specialists. She came in to meeting with us with a accordion folder, because that was I want to say almost 10 years ago. So that was pre kind of pre our tracker. I'm not going to say it wasn't pre-internet, but it was still when people used a lot of, printing and putting things in their accordions. But she had tabs, these are my labs, these are my medication, this is everything. And I looked and I was like, oh my gosh, like this is so hard for the patient and for the doctor, because I'm thinking as a provider, if patient comes into me with the accordion full of information, this is very hard to sort out. And then, like what's important, what's not important, it's very difficult. So you need to learn how to help your providers take care of you better. And so there were a lot of questions that came up that I wanted to answer, but I wanted to just point out that Abigail, thank you so much. She put in the chat a link where you can click on that you can request our tracker. It is truly amazing, and people say, a lot of people said that, it did. I'm not going to say it saved their life, but it definitely saved their time, energy, money, and resources by just utilizing it. But it could truly help you guide your providers in the right way. And as somebody that see patients once in a while, I can tell you it's very hard when patient comes in and patient will start saying how my left eye was itching yesterday, and then my fingers hurt, and I'm having a little trouble with the low back pain, and like 100 different symptoms. And you have to kind of sort out what's important, what's not important, what can wait, what's acute. So help, you know think about it. What are you here to discuss with your doctor today? Like, what is the most important? If the visit ended 5 minutes from today, what it is that you wanted to come out of this visit? Because a lot of times we spend a lot of time just kind of talking, complaining, explaining. The tracker will help you get to your things, stay in order, and kind of stay on track. So I'm going to come up for air. And if you don't mind, so why don't we maybe go through a few questions? And I'm also not looking at the chat. I'm not sure if people are asking questions here.
Okay, I'll start with the first question we got. How do you advocate for a treatment you want, or how about a treatment you don't want?
Mm, it's a wonderful question. And I would say step back. Let's understand why, what are the reasons that you want something or you don't want something. So number one, my rule of thumb is, we have internet, thank God. But when you Google things, you have to use something that's called evidence based. So I would absolutely look, for example, and I put a link on the chat. Sarcoidosis Research Association has a great information on all of the protocols for sarcoidosis. And keep in mind that primary care providers are taught very little about sarcoidosis. This is something that, is taught in medical school as, yes, this disease exists. And then it's on the boards. And during their residency, if they're lucky, they get, a few patients a year with sarcoidosis, so they still remember. But it's pretty rare disease. So, some primary care providers have less than handful of patients with sarcoidosis throughout their career, and they might not be necessarily up to date. And remember that sarcoidosis is very interesting in the sense that majority of patients, thank God, have very, very mild disease to the point where they get diagnosed because maybe they have a hospitalization, they have a flare up, something happened. It does take a long time for sarcoidosis to be diagnosed because the symptoms are kind of vague and not necessarily like right in your face, because it's outside, it's May, everything's blooming, you walking, you start getting runny watery eyes, runny nose, you start sneezing, this is allergy. So that's pretty easy. Some things are very easy to diagnose because it's, as I call it, kind of like right in your face. But I remember when I was in school, my professor in pathophysiology said, you know good doctor will always look horses for a horse in a zebra um, horde. And it took me a while to, I was like, what? Basically, what it says is that 90, over 90% of your time, the diseases that you see are kind of similar. There's something that happens to people over and over again. But in some occasions, you will have this zebra or horse, the other way around, where, the everything seems like something else, but it's not. So a good provider will always keep in mind that there could be something other than just a cold or bronchitis. A lot of people have, long pulmonary sarcoidosis. So, so my long rant into say, first of all, you need to understand why you want a treatment and why you don't want a treatment. And you shouldn't want a treatment because you heard from your friend from the support group that prednisone worked better for her and that's what you want, because we're all very different. And I can tell you, even studies on twins, a lot of studies said that, what works for one twin may not necessarily work for the other. We are very, we're all of us are very unique, and we all have a, different, I mean, everything. So understand why you want something and why you don't want something. And I always say also is that when your disease is so rare and so specific, you would do yourself a huge favor by finding a true specialist in the disease. So kind of the, micro specialist. So, we work a lot with Hopkins and Dr. Carr, who is a true sarcoidosis specialist. And those are the doctors that, get extra training. They, actually open up the centers for, let's say, for sarcoidosis. And on our website, it's so awesome. We remember we're nonprofit. We don't owe anybody anything. Nobody owes us. So our skin is in the game of helping you. So if you'll see any doctors on our website that are sarcoidosis specialists, it's not because anybody paid us or we promoting somebody. It's just we found people that truly have that specialty that they say, yes, I take care of patients with sarcoidosis. So I say, number one, try to find, go on our website and try to find doctor in your specific geographical area that is sarcoidosis specialist. This is going to be your best. This is your quarterback, always on your side, always understands, always knows. And then ask them and say, doc, I know you said I should do this. Can you please explain to me again why? What are the benefits? And what will be the consequences if I don't want to do this? So always be respectful. We're all people. People come with their egos and their knowledge. And sometimes, people just do what they're used to doing. So you need to learn how to push your providers to think a little bit different. My my personal thing is, if I want a true answer, I would say, Dr. Abigail, if I was your sister, what would you recommend? And you have to look at the age. You have to look. I'm not going to say if I was your mother. I'm not that old, Abigail. But, obviously, just kind of find that place of, if I was your mother, if I was your sister, if I was your friend, what would you do? Number one, it kind of stops your doctor, your provider, and help them think a little bit deeper, a little bit more about you. And then if you truly don't want something, you have to have a reason, right? Remember, it's always your choice. You always have to advocate for yourself. You always have to try and find out information. But if you say, Dr. Abigail, I read that, like, whatever treatment that you're offering, it has, these severe side effects, and I'm worried about them. Can you please help me understand? Have the conversation, because if you'll just say, I don't want it, and I don't want it because I Googled it or whatever, then you're putting your provider in a position of, um, kind of, it's almost like arguing with you as to why you need it. Ask them questions. Help me understand, Dr. Abigail, why is this treatment important, and what's going to happen if I don't get that done? So that's number one. Number two, if you're not sure, and if you can afford it, and I understand insurance deductibles and co-insurance, that those are important, try to get, if this is very important, try to get a second opinion. And always remember, I advocate for telehealth a lot, because if you don't need like a physical exam, if we're not talking dermatology, if we're not talking, something that needs to be necessarily touched, you already talked to one doctor, you understand, you now just want a second opinion is whether or not this treatment is correct. Get a second opinion, do it telehealth. You can get in to see this provider way faster. You don't have to drive, so you don't have to wait in the waiting room. So, number one, understand why you want it, why you don't want it, and then ask appropriate questions. get second opinion, but most importantly, get it from people that are in sarcoidosis space and not your neighbor who is a neurosurgeon who told you that one of his patients 20 years ago did something or didn't do something. I, I know I went too much, but it's very important to understand because I can tell you as providers gets very defensive sometimes because imagine when you're seeing 20 to 25 people a day and 25 people go on Google and find, Dr. Google that says, drink cranberry juice, don't drink orange juice, and then they come to the doctors with these, questions and kind of nonsense. It's hard for these doctors to advocate, to really explain to you why. So ask appropriate questions and ask intelligent questions.
So I have a two-part question. I hope you can answer. So
Faster.
first part is, what's the best way to coordinate care between physicians not on the same EHR system?
Yeah.
And the
Yep.
second part of that is, how can I confirm that my healthcare providers are collaborating effectively across specialties?
Yeah. That's wonderful question. So, number one, you can try and advocate as much as you can, but it's all up to you. You cannot, if Abigail said, listen, I'm in Epic, and Sol said, I'm in another EMR, and they just don't communicate, what can you do? So you can do this by, again, utilizing our tracker, or you can even ask, you can call your provider from one that uses one AMR and ask for your information to be shared with another doctor. They do it kind of via portal, via faxes. Unfortunately, right now, I'm going to be honest with you. Everybody are so short staffed. Everybody are suffocating with not enough resources. Most likely consider it not being done. So you need to do it yourself. Ask for printout of your last visit. When you leave your doctor's office, by law, that information belongs to you. You can ask for printout of your visit. Every EMR has a portal. You should be given the access to your portal, to your EMR, where you can print all of your information. But again, remember, you go and see a new doctor, you don't want to bring 25, 30 pages of stuff that they need to sort through really quickly in front of you, and they now have less time to talk to you. So if you utilize the tracker or just something that you can put in your own document, like this is my medication list, these are my last labs, these are the specialists that I'm seeing, and I was hospitalized here for this, and I'm seeing this doctor for that. That is pretty much what you need. But you can ask, but it doesn't mean that it's going to happen. And some offices have case managers, so always ask if the office has case manager or social worker. They could be instrumental. Again, super busy, very kind of overworked, so I can't guarantee that they'll help you, but they can if they're there. um, and so that was the first question, kind of like you take it in your own, this is your hands, this is your health. You need to, I'm sorry, but you need to schlep your information from one doctor to another. If you want them to communicate, you cannot make them to communicate. And how can you make sure that the care is coordinated? It's back to, everything is fragmented. Nobody is, right now everybody's still kind of in their own swim lanes. And this is why I think one way to get your care coordinated is to find a place where you can be under one umbrella. So, for example, I'm not advocating for Hopkins or for GBMC or for Mercy. I swear to you, I have no skin in the game. But if you pick, let's say, Hopkins because your primary care is there, and you'll ask your sarcoidosis specialist for neurologist, they're all going to refer within their umbrella because that's how they work. This is how your care could be coordinated. And we're working very hard in Life and Breath to find and hire a patient advocate or care coordinator that might be able to help you, but we're not there yet. It obviously costs money, and we're trying to raise it. But if you actually go to sarcoidosis clinics, right, like Hopkins has sarcoidosis clinic with Dr. Carr, they have a case manager, they have a social worker, they have a lot of things already in place. So my I always advocate to try and stay within one umbrella as much as you can. And if you don't like few of your doctors in that special, under that umbrella, then maybe go and research other umbrellas where you can find all of the other doctors and transfer your care there. But the worst thing you can do is see a neurologist at one place, cardiologist and the other, primary care is a third, then you're fragmenting the care that's already fragmented, and then you're going to be working extra hard to make sure that everything is connected and everybody's communicating, because they unfortunately they don't have the time, nor do they have incentives to communicate with each other.
Thank you. This is another very good question. What are my rights as a patient if I disagree with a diagnosis or a recommended treatment plan?
Mm. So it's very interesting question. I'm not sure what you mean by disagreeing with diagnosis, because if diagnosis is made by, let's say biopsy, and the diagnosis, it is what it is, I'm not sure how you can argue with it. But I always say, if in doubt, get second opinion. It's money well spent, even if you have high deductible and copay, but it's money well spent. And don't be afraid. And actually, the opposite of, when you schedule an appointment, just say, this is a second opinion from my provider, and this is why I want a second opinion. I feel that maybe my diagnoses are not correct. Can you please confirm what other tests can you do, and how can you confirm or deny the diagnosis? I am not I don't understand, or I'm not, my doctor is promoting this treatment, and I had a conversation. Again, remember, conversation is, what are the benefits? What are the risks of me not doing it? You'll be surprised that sometimes the risk of not doing it is not as harmful as people think. And as I said, a lot of doctors just kind of learn, they're pushing the medication because that's a protocol. But if you actually look at the studies, placebo works amazingly in many instances. And I'm not advocating for it, but what I'm saying is, we need to be educated, and we need to know, all right, as a patient, you're right, always, is to refuse any treatments, is to change your mind at the last second. You can sign all of your pre-op documentation. You can be in a gown and a cap and scrubbed in for surgery. And you can say, you know what? I changed my mind. And by law, nobody can stop you. So your right always is to agree or disagree with the treatment, go along with the treatment, ask for second opinion. Remember that your medical information belongs to you. It is stored in the EMR that doctor paying for, but it belongs to you. So you have a right to get full records, and you can do it on your own from the portal, or you can ask for copies from medical record. But your right is, it's your documentation. You can change your doctor at any time, even if you're an HMO. You can call and say, today I'm leaving Dr. Abigail, I'm coming to Dr. Saul, right? They just need to know, because they need to send you, oh, sorry, Abigail, I'll never leave you. They need to send you a new ID card. But your right is always to accept or refuse the care. My plea to you is, don't refuse it for the sake of refusing, or don't accept anything for the sake of accepting. Always have a conversation. Doc, can you please, I love to use the phrase, Doc, can you please help me understand? Or if I
But
was your sister, like, what would you do? And don't be afraid to say, I thank you for it. I know you told me that. I'm a little nervous. I think I need one more explanation. Or can you try to explain it to me a different way? I didn't get it. But don't leave the office knowing that you don't know, like you didn't get it, and the doctor thinks that you got it, and now you're upset, and now you want a second opinion. Sometimes it's just that communication. Listen, I'm sorry, call, get another telehealth. Help me understand this again.
so Dr. Koyfman, the question, uh, it runs directly into your response. How can I respectfully seek a second opinion without offending my current doctor?
Yeah. So again, great question. I think doctors get offended when you're doing that kind of behind their back, because if we're under the same umbrella and I'm seeing you as a second opinion, some doctors will request the records because they want to see who are coming in. And then by request, so I can tell you, full disclosure, I had an amazing pediatrician, loved her. Something happened where she missed the ball. And I said, okay, well, I'm going somewhere else. I called, scheduled an appointment. The second doctor got in touch with the first because it was kind of pre-internet. They requested the records because with kids, as you need to know their vaccines and stuff. So my pediatrician called me on my cell and she was like, Irina, what happened? What happened? Why are you leaving me? And then I was like, oh my gosh, I should have been really honest and just say, like whatever happened, it's my choice. And I think she wouldn't have been upset. I think she was upset because she didn't know that anything happened, right? Something happened with her office, like she didn't know. So, number one, again, very respectfully, talk to your doctor and say, Dr. Saul, I know you told me that before. I'm still not fully understanding my treatment plan or my treatment goal. Please help me understand. And then if you still don't get it or something is happening, I would say, look, no disrespect. I like you, but this is my health and this is very important. And I know sarcoidosis is rare disease. I think I'm going to seek second opinion, and I would love for you to work with the second opinion provider as well, only because, we all see things a little bit differently, and I just want to make sure that if I'm going to go with this treatment, that I'm looking at every angle. This conversation, I can tell you, number one, it's gonna slow your provider a lot, and they'll be like, "Oh gosh, maybe I missed the ball. Like maybe let me think this. Let me relook at this. Let's do this together." Or they can say, "You know what? I'm very happy that you're getting a second opinion because I myself maybe has not a case. I have not had a case like that." Uh, You know, uh, Doctors that I respect the most are the one they'll say, listen, I don't know what it is. Let me figure out, let me call around, let me talk to my colleagues, let me do a little bit of research, let us figure out together, than the ones that say I know exactly what to do and they don't. So I think that if you get a defensive doctor who is like, why and what and you should, then that's a good way for you to know that you need to go get a second opinion, you need to get another doctor. It's anytime, my daughter car needed to be repaired, my husband took it to two different mechanics because everybody's seeing it different. He got a little different, our body is very, we have organs, they're very I don't want to say mechanical, but I talked to two cardiologists once about a case that I had, and two cardiologists from the same practice gave me two different opinions on the medications because one liked, it was the same class of medication, but one liked one medication a little better, the other one liked the other one. So within medicine, there are guidelines, and within guidelines, it just a lot of times it says, for example, use beta blockers for cardiac, for hypertension. But beta blockers could be labetalol, metoprolol. I mean, there's so many, medications in the class, and doctors use what they're used to. Or some people just go, they early adopters. The minute something new is up and they read the study, it's like, oh my God, it looks amazing, I want to do it. Some people are very conservative and they want to continue to do what they've done before because they feel more comfortable. So different providers may have different opinions, so just be respectful. I think it's better to tell them to their face that I still don't understand, or I'm a little conflicted in what I should do, and I totally hear you. I understand what your plan is. I think I want to seek second opinion only because I wanted to get a little deeper into it and understand my options a little bit more.
Thank you. Next question. My doctor wanted to order an X-ray. I just had the same X-ray ordered a month ago. He said he trusts his own group.
Ah,
What should I do?
ooh, that's a tough one. That's a tough one. So let me tell you, so two scenarios. Number one, the who he trusts, he or she, let's just say they, who they trust could be a company that has newer equipment, much better resolution. Maybe they trust the radiologist that's there because they have the relationship where they can call the radiologist and say, Abigail, I don't understand. Look at this again. Um, and their heart is in the right place. They want the best for you. The other option is they have a little bit skin in the game, and the more the referral to that facility, the more they get something out of it. And there's no way of knowing unless you really go very, very deep and see what the reasons are. But x-rays, it's radiology, it's radiation. It's radiation. And I always advocate for, as less radiation as you can. So my question to this doctor would be, I understand you want me to go to your facility. Please help me understand what in the previous x-ray you did not see, or what are you hoping to see in a with a new x-ray in the facility that you didn't see in my previous. Stop and have them think. And if the answer is I'm getting some sort of kickback where I need to refer to them, they won't have the good answers to you as to what this new facility, what this new x-ray is going to offer. But if they're right away, they're like, look, I just had somebody diagnosed with, lung cancer from this facility where the person came from advanced radiology and they missed it. I trust them more. It's going to come out of their mouth so fast. You'll know that they're passionate about your health and not financial responsibility. Because if they'll start, okay. So ask question is, can you please help me understand? I just had an X-ray, it's radiation, so I'm trying to minimize my radiation exposure. Can you please help me understand what in my previous X-ray you did not see that you hope to see in a new one? Boom.
Thank you.
Sure.
Next question. How can I make sure that my doctor explains medical information in a way that I can fully understand without being embarrassed?
Oh, that's such a great question. So I'll number one, please, like if I feel embarrassed sometimes if I talk to specialists because everybody have their lingo, and if you're not used to it, it's okay. And know for sure that not everybody in healthcare and not everybody in medical, in healthcare understand each other. So please don't be embarrassed because that's normal. Um, a lot of places right now work on what's called health literacy, because health literacy said that you can be PhD in astrophysics and you may not understand what your cardiologist is telling you or your neurologist is telling you. I'm not sure I keep saying cardiologist. Pulmonologist is telling you. So it is okay. You're part of probably 90% of the population who come out of the office not understanding more than half. So number one, always bring a pen and pencil, like pen, pencil, and a notepad. Take notes. Even if you don't understand, say, I'm sorry, can you spell this? I've never heard this word before. Can you please tell me what it means? I'm not a medical person, so I don't understand. Slow them down, tell them, I'm not in healthcare. This is all new to me. Please help me understand. Spell it, say it slowly. The best I can say is if you can bring somebody with you, because I can tell you that um, somebody brought me together with a brand new diagnosis of cancer. She was so stressed out. She was a friend of a friend. There was three of us. She was so stressed out she couldn't even grasp the information. Another person, her best friends, would with her because she knew her history, so she can answer a question. And I was there to like take notes, so then we can go back, and because it's a lot, it's a lot. And there's no embarrassment in bringing other people. And I always give back. I always try to go and help as many people as I can. So anybody you can bring, neighbor, friend, they don't have to be in medical care. Have them have a pen and take notes while you talking to the doctor. Slow them down, and there's no shame to say, look, doc, I'm a teacher, or I'm a waitress, I'm an accountant, I'm not in healthcare. Please slow it down for me and talk to me like, you know, like I'm an accountant, and make it humorous. They like it, they'll slow down. It's just a lot of times they're not bad people. We're not bad people. We're so busy. And when you do something for so long, sometimes it doesn't occur to you that people don't understand. So we have to be helped by our patients need to tell us, look, doc, slow down. Tell me like I use the word, I'm like, tell me like I'm a 3-year-old. When I talk to my finance guy, I'm like, look, I have a PhD, but talk to me like I'm a 3-year-old because this is not my space. I don't get it. And it helps to bring them down to, hopefully somewhat my level. Then I still take notes, and then I still Google, and I still ask questions. but don't be afraid or ashamed.
Thank you. Dr. Koyfman, what are the top signs you see of a good doctor?
Oh, you guys have such amazing questions. It's so hard to pinpoint, but gosh, so I can tell you, number one, always research, always look at reviews. But please, do you know how many reviews I read when they gave a doctor like 2 stars because they said receptionist was so rude or I couldn't get my appointment? Those are all good reviews, but if you want to understand if your doctor is a good doctor, the receptionist change tomorrow. Like now, or I love the office. Every time I come in, they have a coffee and they have a what. I'm like, tell me about the doctor. So when you read reviews, actually pay attention to when they talk about the provider. What do they do? Are they knowledgeable? So read that. That's very important. Um, I think to me, um, I think bedside manners are very, very important. uh, because everybody goes through a very difficult medical school and the residency and they become attending physician. Like the knowledge is usually there, but you can have a doctor who is so rude that no matter how much they know, you like they not giving you information, they rushing. So to me, I think it's both, read the reviews to see what they're talking about the provider, not the office, because office things change. um when you come and see the doctor, are they looking you in the eyes? Are they actually talking to you? I think it's very important that you connect with it. Honestly, when you have a disease that's, it's not like you could go once a year to your primary care physician, but you need regular care. It's almost like dating. Like sometimes you go on a date and you see that's not something that I want to continue with. I literally had a visit. I never tell when I see a provider that I'm a provider myself because I don't want them to be skewed. But I can tell you that there were so many things that were done wrong and not kind that I was like, yeah, I'll be back. Never. So, but she came very highly recommended. Reviews were great. She's a specialist in the area that I was looking for, and I did not like her care of me. So I said I'm never going to come back. Is it going to cost me money? Yes, because now I need to pay yet another copay and yet another deductible. But to me, it's worth it. You don't want to go on this bad, second bad date, right? So it's and it's very personal. It's very hard to say, if I could love Dr. Abigail and Soul might not like Dr. Abigail, which I find it hard to believe. But do your own, come visit, and you could even stop by the office and see, talk to. I mean, it's hard, but it's very, very personal, I think.
Thank you. What do I do if my doctor looks at me as if I'm crazy?
So great question. I would have to have a lot more context in the question, but um I would say you need to come to every visit very prepared. Don't forget that doctors are people that have families, that have things happen. They could just gotten a call that their kid got in trouble in the middle school and they need to rush right after they see you. You have no idea what's happening with them when they're seeing you. So come prepare with your list. Dr. Abigail, this is my list of questions. This is what I wanted to find out today. This is why I'm seeing you. I had this symptom, it started this time. This is what I got. I ran out of this medication. This medication gave me whatever it is, write it down and go kind of point by point. Because as I said before, when patients come in and they're so kind of disheveled and all over the place, and as a provider, I can't really get the history out of them. And on the back of my mind, I was like, oh my gosh, the time is ticking. There are 5 other people waiting in the waiting room. And I'm trying to understand what it is that you need. And you have no idea what you want from me. It becomes pretty difficult. So it's almost like, when and we all been there, right? We come to a restaurant, we see the menu, the 20 pages, and we take so long and we have no idea. We're like, oh my gosh, and should I have this and should I have that? And we kind of make ourselves a little crazy And I'm sure our waiter is getting a little, annoyed. So try to minimize that. This is why a lot of times when we go out, I would look at the menu prior to. I would go online and look at it. So kind of like I have an idea, and then I can make that experience better for me and for the person who is waiting on me. So have your list, have your questions. This is why I'm here. This is what I need. And at the end of the day, when you feel that you just don't, there's no match with the doctor, and this is your second visit, and they still look at you like you're crazy, and you know that you came prepared and you've done your homework and you've done your thing, it's time for you to find another doctor.
Okay, thank you. Uh, this is a tough question. Is there a standard practice across the board that doctors follow for a certain type of treatment?
Yes. So on the very top of the chart of our Q&A, I sent the sarcoidosis.org treatment protocol. So this is just for sarcoidosis. Keep in mind there are in medicine we have guidelines. Guidelines dictate what providers should do, but it's not um what's the word I'm looking for? It's not like a law where if you drive 65, you're fine. If you drive 66, you're outside of the law. So guidelines are just that. They are guiding your care, and it's based on studies. It's based on evidence. This is what providers follow, and every disease have the guidelines. Within the guidelines, there's a lot of room to maneuver, and nobody, and you don't want that. You don't want to, you don't want to be cared in a system where it'll say everybody, looking at Abigail, that has sarcoidosis and red hair needs to have prednisone, and everybody that has sarcoidosis but blonde needs to have methotrexate. You want to have ability for the doctors to say, look, this medication works, this medication works, this treatment works, and then doctors can kind of swim within that lane and see what works best for you. So you can always look up any guidelines. You can say hypertension guidelines, sarcoidosis guidelines, whatever, breast cancer guidelines, and you'll find what is evidence based, what is appropriate. But then your provider is the one that decides. And again, like if you come prepared and you look at the guidelines and you kind of get yourself um, educated on what's available and what's recommended, then you can have an intelligent discussion with your provider on like what your steps. And if they'll say, listen, you know, the guidelines say you need to be on this, but in my experience, my patients, when I put them on this medication, they do better, then it's something for you to think about. Great questions. Thank you.
Okay. Next question. Is it appropriate to ask my doctor to provide additional printed information on my condition or my treatment?
100%, but so many EMRs have a lot of information there that is available with a click of a button. And absolutely, you can and you should. It's just that not everything is available, and maybe not every provider knows exactly where to find it, but you can always and you should always ask, because a lot of times they just don't take that extra step of like printing it, but always ask. And yes, absolutely.
Thank you.
Yep.
This is a technical question. My brother has sarcoidosis. He's currently in the hospital with possible meningitis secondary to methotrexate. How can we help, or what can we do to help?
So I can say, so again, remember, I'm not a treating provider. I have no idea. I don't know anything about, the patient, their history, nothing. All I know is this question. So I can't answer it as if you were to ask me as a second opinion with all of the, EMR information. But I can tell you what I would do is in a hospital, there are case managers. Case managers, or sometimes they're called discharge planners, they're all social workers. Sometimes they're nurses, but they're in like a social work environment. And they're trained to help and guide you and make sure that A, you as a patient do not get readmitted to the hospital. and B, that you have all of your appointments set up, your medication is being delivered to your home, kind of, at the time of discharge or right after discharge. So my guidance is always find out who your brother's case manager is, and get in touch with them before they get in touch with you. Because this is where you'll say, like, you ask all of your questions. You will ask, because, your question is, how can I help my brother? It's such a broad question that it has pretty much no answers, because I have no idea what kind of help are you looking from me, right? Are you looking for me to find a neurologist for him? Are you looking for me to find a pharmacist who understands, like, doctor that, like, we have Dr. Richard Harris, who's MD and he's a PharmD doctor and a pharmacist. Are you trying to find a place for him to come home to that has a care? Like, it's just learn to ask a question that is narrow, where you can actually get an answer. And it could be five different questions. How can I help my brother with medications, with finding a doctor, with making sure he has, I mean, I don't know, it's, does he need PTOT? Like, where is he? So try to break it down, but case manager would be your best, I would say, best bet. And also keep in mind that insurance companies, they are in business of your brother never coming back to the hospital again. So they also have disease management managers, they have case managers. You have to look on the back of the card, and it usually says disease management or case management. You can call and say, my brother's in a hospital. I want to help him. These are my questions. How can you help? And they have so many resources that we are not aware of. You'll be surprised. Sometimes they can even set up like a free transportation. They sometimes do miracles. So always try to utilize your insurance as much as you can, because it's not anything you pay extra for, and there is no deductible copay or co-insurance. It's part of the medical plan. So utilize them as much as possible, and utilize hospital case managers.
Thank you. Time, but I'd like to thank you, Dr. Koyfman, for a wonderful presentation, and thank you all who have attended and participated in the Q&A. I think we have some fantastic questions. We do these educational webinars on a monthly basis, so please check the website for the next upcoming talk at lifeandbreath.org. So thank you again very much, everyone, for attending. Good night, and have
Stay
a safe.
healthy. Happy Thanksgiving coming up. Stay healthy, advocate for yourself, and know that you need to be your own patient advocate. And I wish you all the best in the future.
Well said. Thank you, Dr. Koyfman.
Bye bye, everybody.
Bye.